back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls about your chronic pain issues here at 866-870-5752. That's 866-870-5752. And check out the website at www.lastemcells.com. And we're going to go to Ron in Santa Ana.
Hey, Ron, Dr. Marc Darrow, I understand you have knee pain. How long has it been there?
Yes, doctor. I do have knee pain, and it's been going on probably, for 6 months. I believe what happened was I did irritate the knee by falling on it about 6 months ago. I must say that I'm in pretty good shape. I do go to the gym all the time and do a lot of exercises, and I've actually gone to some physical therapy. And I was just listening to your program because I'm actually going to be seeing a surgeon this coming week to get an evaluation from him as to what's going on. But I'm be very interested in learning more about this because I have heard about it from another friend of mine who had this type of treatment, and it seems to have worked very successfully for him.
All right, cool. Number one, I'm glad you are going to see a surgeon, although I don't want you to have surgery. It's good to have what we call informed consent in medicine. That means that before you do anything, you know all the possibilities. So I actually do send people to surgeons for an evaluation, not for a surgery. I can't remember the last time I sent anybody to a surgeon for a surgery. And the reason for that is that most of the surgeries don't need to be done and can cause terrible results. I'm not making this up. I'm not trying to hustle you. I'm just telling you my experience in over 20 years of medicine.
That's sort of what I was thinking of. I'm certainly not going in to schedule the surgery. I'm going into my regular doctor said, let's get an orthopedist to look at it and see what's going on. So I'm assuming he would do an MRI. I've already had an X-ray, and all the X-ray showed was a little bit of arthritis in the knee. I am 75 years old, so I'm not a youngster, but I think I'm in reasonably good shape for my age. And like I say, I do go to the gym 3 times a week and do a lot of weightlifting exercises, which really seems to help me a lot. So, I'd be very interested in getting a copy of the book that I heard mentioned.
Yeah, we'll send you a free copy of our book, which is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it's really an excellent book for everybody. I wrote it very simply, but it has a ton of research. You can bring a copy of it to your doctor if you like. We can send you out a couple copies of it because you called in the show.
Okay, very good. Well, I really appreciate it. I'd love to take a look at the book.
I got a lot more info for you, which I'll talk about if you want to stay on, and I'll talk about it even if you want to hang up. So the fact you haven't said you're laying in bed now, you haven't said your knee is stuck, so I'm assuming that you're still walking around.
Oh, no, I'm in reasonably.
Is that correct?
In fact, it hardly bothers me at all. Because I think the exercises I do and the stretches have really helped. Like I say, I did go to a physical therapist, and he worked with me for about 4 or 5 weeks and showed me several different exercises to do, which seems to have helped. That certainly has gotten me, considerably more comfortable. But, when I sit for a long time and I first get up, that first step is really pretty tough. Just on that particular knee. The other knee doesn't seem to bother me as much. So, the treatment does sound definitely worth taking a look at. Thank you so much.
So I have a little bit of a warning for you. Please don't let him inject cortisone into your knee.
No cortisone.
You know what cortisone is? Yes. Okay. Cortisone is a steroid,
I won't let him do anything. I'm going to look at your book, and I'm going to see. I'm assuming he'll do an MRI. Would that be the standard thing, the first thing a surgeon would want to do?
What I find that patients tell me is the first thing that happens is they get a cortisone shot.
Aha, and you say stay away from cortisone.
I would, because it dissolves away the cartilage on a weight-bearing joint like that.
Yeah.
I wouldn't do it one time if I had the choice.
Okay, well, I appreciate that tip very much, so I will definitely not let them stick a needle into me. But anyway, hey, I'm driving right now, so I don't have a great connection. But who do I
That's
talk
fine,
to
yeah.
give them where to send the book?
It's already handled. We have your phone number just by you calling in.
Oh, wonderful.
So we'll take care
Okay,
of that.
well, thank you so much. And, I'm really...
God bless, man.
First time I've heard you on, but it sounds very interesting and very something I'm very interested
I mean,
in. So.
the great news about you, Ron, is the way you're talking about your knee. You sound like the guy that might just get a PRP injection and heal that up. It's not that bad. And if we found something worse, we might consider using a mixture of PRP and stem cells, but that's to be determined after your examination. If you want to call the office, our phone number is 800-300-9300, and you can check.
I can't write down right now. Like I said, I'm driving. I'm just heading over to Home Depot.
Sure.
But I will.
That's why I have an easy phone number. 800-300-9300.
800-300-9300. Okay, that I can remember. Thank you.
All right. God
Thank
bless
you for
you,
your
man.
call,
It's great
Ron.
talking to you.
Our number is 866-870-5752. Call now before the hour just pitters away. And let's go to Gary in San Pedro.
Hey, Gary, Dr. Marc Darrow, I understand you have tendonitis. What part of your body?
Yeah, thank you for taking my call. I've had this tendonitis since the beginning of May, and I've been to my podiatrist, and I've iced it, I've stretched, and those kinds of things, but it's just not getting better. On my heel, it's very swollen. I can walk, I hobble around. My purpose in calling is just to see if what you offer might be able to help my situation.
Okay. When you say it's very swollen, that doesn't ring a bell for someone that just had something 3 months, unless it is something very inflammatory, infectious, or something like that. Is it really swollen, or does it just feel sore?
No, it is swollen. I would say if you took a tennis ball and cut a third of it off, that round part of the last third would be about as big as it is.
And what did your podiatrist do for you?
Well, he's sending me to physical therapy, which I haven't started yet. And he did say he did not want to do surgery. The good news, he said, was that the tendon had not ruptured, so it's still intact, and he wanted to treat it just by physical therapy and more icing and that sort of thing.
Did he get you an MRI of it?
No, but I had an X-ray just the other day. I don't have the results of that X-ray yet.
So let me explain MRIs to you. In your case, I like the idea of an MRI because we don't know what's going on. That's not a common thing. I've never seen an Achilles tendon area or the back of the calcaneus, the heel bone, swollen as big as a tennis ball or a third of it or whatever. So I'd have to get a picture of that and see what's going on. A picture meaning I'd like to see it physically.
Yes.
Something that unusual I'd like to actually get a look at with an MRI. MRIs are not a reason to get surgery, though, because very often an MRI will show something that isn't really even there because they are overly sensitive. They pick up things, they make up stories that don't exist. But I do like to get them as an adjunct to my examination. So people come in, they say, I heard you on the radio. Why are you telling me to get an MRI? Well, the reason is because it is good information, but you don't get surgery based on it. As an example, many people have a meniscal tear in their knee. They find it on an MRI, and then they go get surgery when they never needed the surgery because the surgeon says, look, there's a meniscal tear. Well, we don't know if that meniscal tear has been there for 30 years. And the person didn't have pain, and then they jam their knee, and all of a sudden they have pain that's not related to the meniscal tear. So please, everybody, understand, I like MRIs, I just don't like doctors doing surgery because of them. So your heel I'd have to look at...
He really did not want to do surgery because of my age, and also the long recovery time. He didn't think that was a good idea. But because it's
How old
not
are you, Gary?
structured, he said he didn't think at this point anyway, surgery we should even consider.
Yeah, how old are you?
79.
Boy, you sound young, man.
I was
going to
say
voice.
that. Really young.
Yeah.
Thank you.
So anyway, I need to look at that, or you need to get to an orthopedic surgeon or someone else. I love podiatrists for certain things, and for things like this, I don't like them as much. Nothing against you guys. You do good work. But that's a private conversation. If you want to email me, go to the website, www.lastemcells.com. That's www.lastemcells.com. Tell me we spoke on the radio, and I'll have even more information for you. Or you can just call my office at 800-300-9300, and we'll see what's going on with you. You can always call in, even now, to see if we take your insurance. We do take Medicare, Cigna, Aetna, Blue Cross, Blue Shield, United Healthcare, and for people without insurance, Care Credit. And different insurances don't necessarily pay for the treatments, but they often pay for at least the first visit and some of the other things we do in the office. All right, Gary?
Okay, that sounds good. Thank you very much.
God bless you, my friend, and good luck in your healing.
Thank you. Bye-bye.
Thanks for your call, Gary. Take care. Bye-bye. Our number is 866-870-5752. I have lines open for you right now, and let's go to Betty.
Hey, Betty, Dr. Marc Darrow, I understand that you have knee pain and you have to get surgery. Is that correct?
Yes, Can you hear me?
Yeah, but it'd be nice if you scream at me a little louder.
Okay. Yeah, I'm supposed to get surgery. Now I hear you and I'm scared. But I was scared anyway. Anyway, my two knees, both knees, the doctor wants to do, what do you call it, partial knee replacement. Because on my X-ray...
You know, I can't hear you that well. It sounds like you're on a cell phone or...
hold on, let me go to the other room.
Now you sound worse.
Okay. Is that better?
Hello? Just keep going. Yeah, that's a little better.
That's best.
Go ahead.
Can you hear me now?
Yes.
That's a lot better. Yeah, thank you.
Sorry.
Did you have a question, Betty?
Yes. Could your treatment help me? If I have like this bone on bone in the middle, in the inside of my knee. Could that help?
Okay.
me?
Well, most people that say they have bone on bone, they were told that by a doctor. Nita, we're going to take this off of
Yeah,
her
sorry,
phone,
Betty.
okay,
We
and I'll
just can't
answer.
seem to get your line straightened out here, so we'll give you our
Betty,
answer over the air.
keep listening. Keep listening. I have a lot of information for you. Bone on bone is a way of a surgeon telling you he wants to do surgery. And it doesn't mean you have bone on bone. It does not mean there's no cartilage. And I have patients almost every single day, sometimes many a day, who come in and they say they have bone on bone. If you have bone on bone, there is no slippery surface called cartilage for your knee or whatever part of the body to slide and move. So if you have bone on bone, you're not moving that joint. So there's very little bone on bone that I've ever seen. I do see it once in a while, but very rarely. That's when a joint is just totally fixed. There's no motion. So we can probably help you using cells from your body called platelets or platelets plus stem cells or bone marrow and regrow enough tissue so we can get rid of your pain. The thing that I see most often is when someone says they have bone on bone, their doctor wants to do a replacement of the joint. I don't find that those work out too well. They can, but they fail too. That's going to Las Vegas and gambling, and I'm not a gambler. So be very careful about that. None of these statements are against surgeons, by the way. So please understand that I love surgeons. They do the hardest job in medicine. I was trained in orthopedic surgery, And the long hours, the sequelae, meaning the side effects and all that can happen from it, can be terrible. And these guys have to carry that on their shoulders. So I absolutely love the surgeons. I take my hat off to you guys, but I don't think all these surgeries should be done anymore. I am sorry, it's not against you, it's just the reality. And if you look at the studies, they show that these surgeries can fail, and they show that regenerative medicine, just using injection techniques, can heal most of these problems. So, Betty, be careful what you do. I'm glad you've seen a surgeon. I want you to have informed consent to know that's a possibility for you, and you don't have to believe me. As far as anything in this world, get a lot of opinions, and then you decide what you want to do. But don't let a doctor talk you into what you have to do unless it's an emergency. The work I do is not an emergency, and I tell a lot of people, there's no rush. You don't need to do this. They say, I want to do it now. I go, there's no rush. You do it when you want to, and if you think you need to, after you get informed consent.
Okay, so let's go to Roy in Stuart, Florida.
Roy, Dr. Marc Darrow, I understand.
Hi, Dr. Darrow.
I understand.
Thanks for taking my call.
I understand that you're a doctor also.
I'm a retired chiropractor. I used to play a lot of tennis, and I had arthroscopic on both knees about 7 years ago, top surgeon, and he told me if I continue to play tennis, I need a knee replacement in 2 years. That's 7 years ago. So I've been monitoring my knee through x-rays, and it's degenerated, very close contact, maybe not bone on bone. I looked at stem cells for the last 5 years, and I went to the head of research here. He's the head orthopedic guy that's in charge of monitoring research. And I had a consult with him about 2 weeks ago, and the doctor that does the stem cells has been doing it for 20 years. His name is Dr. Parita down here in Florida. Years ago, he did Bartolo Colon for the Yankees, and after he ejected him, he won the Cy Young Award for his elbow because it was damaged. So I'd like to get stem cells. What I've heard and going through seminars, that when you reach over the age of 40, your harvesting of stem cells decreases. I'm 72 years old, and what they're recommending, if I was going to get it done, is to go with an umbilical source of mesenchymal cells with a wart and jelly adjuvant. But even with that, the head of research here in Florida said that they can only fill in pockets. When you do a whole knee, it's not really going to have a good outcome. I'd like to know what your opinion is on that.
I can only tell you based on my experience. I've done mega thousands of stem cells on knees. And the results that we get in my office and that we do research on and have reported, and we can give you the research also, is that the bone marrow is an amazing way to go. Dr. Parita does that. I know him, and he's a very good doc. He's an orthopedic surgeon, but he does stem cells. And what I'm finding is the umbilical cord blood stem cells work a little bit better in my office than bone marrow. So I wouldn't be worried about having to do bone marrow on your knees, bone on bone or not, I don't care. And I think you'll get a great result if done in the right hands. Now, most of the seminars that are being done out on the street are done by chiropractors. Now, nothing against you guys. I love chiropractors. I had a chiropractor for a partner for 10 years. They have no business selling stem cells, though, because what they do is they will have a dinner where they spend a lot of money and they hustle people in. Excuse me, that's what happens. And then they will bring a doctor in who doesn't know a blessed thing about how to inject or what to use to inject a lot of people. And the results are not very good. So my point is this. If you're going to get anything done in medicine, go to the guy who does the most. Parita does a ton of them. I do more than he does, okay? I've been told I do more than anybody on the planet. I'm not saying go to me. I'm just saying don't go to one of these seminars and get injected by a guy who doesn't even know what he's doing, all right?
Dr. Roy, are you there?
Can you hear me?
He's mad at me.
Oh, there you are.
Yeah.
There you are.
Yeah, I'm sorry.
Roy, we were worried that you dove under the water.
No, no.
I don't know about those alligators in Florida.
Well, they're around. Well, no, my specific question is, am I better, because I'm 72, and, he has some nutritional things to enhance the stem cell harvest. But my question is, would I be better off going with the mesenchymal cells from umbilical with the Wharton gel as a better way to go because of the amount of stem cells that are being ejected?
No. There's no better way. What I'm going to tell you is your age has zero to do with it. I've done this on a lot of teenagers for their sports injuries and a lot of people in their 80s and 90s with amazing results using either bone marrow or umbilical cord stem cells. They're both about the same in terms of results. In my office, I can't tell you in someone else's office what's going to happen. I'll give you an example of what I'm talking about. I studied acupuncture, which was a course for medical doctors at UCLA. It was a 3-year course. Acupuncture doesn't work when I use it. It works for other people. I've had acupuncture on my body about 50 times. It works sometimes with some people, and other people that do it on me doesn't work. So if you go see Dr. Parita, you got to ask him. If you go to someone else, ask them. But this is nonsense about you need to use umbilical cord because there are more cells. There are doctors who will tell you that umbilical cord stem cells are not alive. There's a lot of, I'm going to use the word nonsense flying around for people to fill their pocketbooks with. Do you understand what I'm saying?
Right. Well, there's also a question that sometimes you don't actually get what you pay for, that they're using inferior quality products.
That's true. If you're going to use umbilical cord, make sure your doctor buys them from an amazing clinic. I use Invitrix in Orange County, just down the road from me. And I've been to their lab. It's 10,000 square foot facility, I think it is. All brand new, clean. They're in, I think, something like 120 countries. They've been selling this stuff for 15 years. And so far this year, I've done, I think, about 700 stem cells with umbilical cords. And I've had amazing results with them. But if you come in and you want bone marrow, I'll give you that. They're both good. But your age has nothing to do with it, I promise you. I'll tell you what the age thing is. One last thing. The age thing is, again, it's from these guys who have no idea what they're doing, that are hustling people, that can't get a doctor. They're just salesmen. They have these seminars. They sell people.
Oops. Well, Dr. Roy, thank you for your call, and thank you everybody who listened and participated, but we are completely out of time, and I invite you to go to the website, lastemcells.com, and communicate directly with Dr. Darrow. And thank you, Wilbur and Nick, here behind the scenes, and all the callers, all the listeners. Thank you, Dr. Darrow. Grab a pen or a pencil, write down this important information about to come your way, and we'll see you next time.